Hello and welcome. My name is Rick Freeman, and I'm here to tell you some hopeful things about what I've discovered about people that have had aortic dissections like I had 13 years ago. The International Registry for Acute Aortic Dissections, it was started in University of Michigan. They have discovered that 80 to 97% of all surgeries that were performed when an aortic dissection was found were done properly, successful. That's amazing. Now, the problem is in the emergency room care. I'm going to use me as an example, and I have some other people that have already died. You go into an emergency room with a normal EKG. They put you as a normal patient. Okay, no emergency. That's ridiculous. Chest pain. Chest pain is an emergency. A normal EKG doesn't show anything. Did they check both pulses? Are both pulses normal? Did they put you in a CAT scan? Otherwise, you're going to die in the emergency room. Or like my friend Chris, he was at the emergency room, a normal EKG. He was sent home, and 24 hours later, he died at home. No autopsy, so there's no proof that there was an aortic dissection. But that's what happens. But if found properly, found quick enough in the emergency room, you have a damn good chance of surviving. And that's amazing. Now, I have my aortic dissection. It started my carotid arteries, it went down to my subclavian, went out of my heart, the whole ascending and the arch of my heart. That's where I was bleeding out of. And I was dying. I was going to die there. And I was screaming. And I was screaming. The nurse came in and told me, I'm just going to have to wait my turn like everybody else. I was lucky. All of a sudden, I got a blood clot in my leg, and my leg turned purple. And they rushed me up to the operating room, and they started to put blood in me, trying to discover what was really wrong with me. So by the time I was flown over to this other doctor, and he was ready to perform surgery, he came down and told my parents I had less than a 10% chance of surviving. They discovered in 2012 the aortic dissection, the rates were rising. There were more aortic dissections. Now, I can only put that to maybe the emergency room is getting better. Maybe they're just putting people into the CAT scan a little sooner. Or maybe more people are actually having aortic dissections. I go back to my Crohn's disease, and it was the mid-1970s. When nobody heard of Crohn's disease, and there were no medications. I was put on prednisone, steroids. And years later, as the Crohn's Colitis Foundation came around and awareness got bigger, more people started to get Crohn's, started to get discovered. And medications started to come around. Now, I think that's the same thing as the aortic dissection. We're in that same level of not just awareness. There's a John Ritter Foundation, there's Aortic Hope, Aortic Warrior. There's all sorts of different groups coming out that are helping this awareness. But the most important thing to remember, if you go into an emergency room with chest pain and they say everything's okay, you tell them, check my aorta. You demand it, because people are dying because of the emergency room and their EKG. Now, amazing. I just got a letter from my local magazine, and it showed that the emergency rescue of the South Hills in our area, they just got in a new EKG machine that will show a pulse in different parts of the body. Now, that's not saying you've had an aortic dissection at all, but that's just saying that could be a different reason. They might want to put you in a CAT scan machine when you're in the when you're in the ambulance getting to the hospital. Well, they didn't have that when I was taken to the hospital. I was just called normal and was just put in a waiting room. So if they came in with an EKG machine that showed there were different pulses in different arms, they might have sent me to a CAT scan machine. I doubt it, but things are changing, and hopefully they will keep changing. And as long as you take control of yourself in the emergency room, in the hospital, learn what you need to learn and ask questions. Do not just say, okay. I've done that so many years, so I can know that's a fault. Just saying, okay, we'll see you next year. Okay. Write down a list of questions. Get those answers and have them contact you if they don't have the answers. And take care of yourself. You're in control. You have the most charge of your body because no one else really knows what's going on with all the other different problems in your body. You know the whole situation. So you need to take control. And I know you can. If I certainly can. I'm almost a half a century of Crohn's disease and 13 years with a aortic dissection, seizures, 2 strokes, and I'm still here. And it's just taking control, not being afraid to step up. I went, when I was down to 98 pounds, I found the doctor and the nutritionist that would get me put on TPN. So I got my nutrition through my veins while my digestive system was trying to relax, and we were trying to figure out how much scar tissue was in there. But that's a whole different story. And if that happens, you can take control. Same kind of thing, you take control. Here's another example. I was having my second stroke, and all I could think of was if I went to the emergency room, they would take at least 30 minutes or longer to just get an IV in my arm because my arms are gone. And that scared me. So I knew I was having a stroke, and I unlocked my doors. I was going to call an ambulance, but that thought just put me on the couch. And then all of a sudden I stumbled into the bed, and I just laid there in bed for a while. And I didn't go to the emergency room just because I thought how the misery they would put me through before they even checked to see if I had a stroke. Then I went and I found myself an infusion center. And I told them the doctor I had 2 doctors that said I needed a port. After I told the doctor, I didn't go to the hospital because they wouldn't get an IV in me. She told me I need a port. Then the other doctor told me I need a port, but no one would really agree with me. So I went to the infusion center. I asked them to call the doctor, and they called the doctor, and they set it up from there. So I had to do that for myself by taking control for my port, and I had to do that for myself for getting on TPN. And that was not just the port was pretty much my misery, but the TPN was to save my life. I was on the edge. So everybody can learn to take control, but you have to learn what's going on with your body. Does that make sense? I hope so. Maybe you got 1 or 2 little thoughts out of what I had to say, and it will help you. Thank you. Thank you.